of the issues that you're going to probably face when you get out. Sometimes you think you know where you want to go, but when you get there, it may not be what you expect. Keep in mind, there's a lot of different areas in nursing. You don't have to make your decision on where you want to go. Just get into nursing and don't be afraid to move around like I did. I basically moved around 2 different departments before I found a place where I feel comfortable with my nursing skill. Also, keep in mind, there's so many different areas of nursing, and I think this is where it kind of opens our eyes a little bit, because as medics, we're trained for emergency medical, or we're trained for critical care. When we get into nursing, we tend to try to follow those steps. Let me either go emergency or let me go critical care, but there's so much more to nursing. You have infection control, you have peri-anesthesia nursing, which I'm a part of. You have, as far as on the surgical side, you have pre-op, you have PACU, you have OR nursing, nurses that work in the cath lab, you have community health nursing. It's just so big. And I think what happens to us, and this is some of my classmates would even contest to this, when you get out into the nursing world, you start to see the opportunities. It's kind of hard to figure out where your place is. And I think that's probably one of the most difficult parts of trying to navigate when you first get out being a paramedic, is trying to find your place. If you get out, if you're getting ready to go to school now and you've already decided, hey, I want to be a flight nurse, you don't be disappointed when you get to the ICU and you figure and start to second guess yourself, or start to think, you know what, do I really want to do this? Maybe I'm starting to have a little bit more interest in being a psych nurse. Don't be afraid. Don't think because you're a paramedic, you have to stay locked into 1 or 2 specific areas of nursing. That's my tip for you guys. Hopefully you guys are on track to get into nursing school or finish nursing school. If you need any questions answered, hey, I'll respond to comments. So see you again. Happy nursing.